And thank you for joining us on the last of our week-long short presentations during Congenital Heart Disease Awareness Week. So our aim was to just really give you some short insights into the whole pathway of care across congenital heart disease from fetal right through to adulthood. And we couldn't do that without considering the psychological impact of congenital heart disease. And I'm absolutely delighted to be able to welcome Emily Bell, who is a consultant clinical psychologist, and she's based at the Freeman Hospital, so in the specialist centre within our region. So, and Emily's going to talk you through about the experiences of living with congenital heart disease. So over to you, Emily, and thank you so much.
Thank you, Kay. Yeah, I'm just going to discuss, so we've got half an hour today. So I was thinking about psychological impact of CHD and what might be useful within half an hour to be able to chat people through. So where I started with this is that there's so much that has advanced in terms of congenital heart disease over the decades in terms of medical care. We've got young people that are surviving and living longer. And the medical advances have been huge in terms of steps forward with that, and there are ongoing improvements with that, with the severity of disease that individuals are living with. As a psychologist, it brings up the question for me about how people are living with congenital heart disease. So what we know from some of the research out there is that having a longer life and having less severe disease actually doesn't necessarily correlate with having increased psychological well-being, and that that's not necessarily what makes the biggest difference when it comes to things like quality of life. So I start then thinking about what we can do as a whole system, and in coming to this presentation today thinking about what I can do in terms of being able to share something for anyone working with a young person or a child or a family or an adult with CHD, to help think about how we can help patients to live longer but better in terms of like quality of life. There's a huge scope for what I can cover in that, and I'm sure there'll be other opportunities to talk about certain other parts of the journey through CHD. But I thought, given the limited time, I'd start at the beginning and think about what makes a difference at the very beginning. So that will be supporting families to cope with the diagnosis, supporting that parent-child relationship, and considering the impact of that later in the journey. So hopefully it does have relevance for those working with young people and with adults as well. So at diagnosis, there is so much that a family is dealing with. I just want to start by drawing people's attention to some interviews with parents that the British Heart Foundation had done, and these are the decades ago. I mean, you can tell by the fashion, these are not new videos, but what's in the content of those is great in terms of being able to really understand some of the experiences of families at the point of diagnosis and onwards. There's, explores their journey, and I'd encourage people to go and look at those. In terms of thinking about this point of diagnosis, the impact for a family is huge and also so individual. The heart's so symbolic in terms of the meaning of having a heart condition for families, and people bring different experiences and their past history to that in terms of the impact for that on individual parents and as couples. Everybody's probably aware in terms of the impact in terms of stress and trauma around diagnosis, but it's worth highlighting that in the research it's a condition that has more, it's shown to have more impact in terms of high levels of stress than other chronic conditions, and whether that's diagnosed antenatally or post birth, both are traumatic. There are different experiences, but both have trauma associated with them. There's different experiences that come from finding out earlier and finding out later. And again, in the videos from experiences with parents, it explores that to some degree. It's worth saying that that period in terms of pregnancy and becoming a parent is stressful enough anyway. but then you've got the shock of that diagnosis, the trauma that comes with that, loss, mourning around how you expected things to go, and how you expected the future to be with your child, the fear and uncertainty that's experienced, guilt in terms of, you know, thinking around, is there anything that I could have done? If I'd only had done that differently, would that have made a difference? Thinking about why things happen, you know, why is this happening to our family? Why our baby? And you know, attempting to get your head around understanding healthcare that's coming, that it's massive. And I couldn't do this talk without thinking about trauma. So because trauma at that stage for parents, it has an impact on how that young person is going to experience things later down the line. So you may, you know, if you're working with parents in this position, that some of this should be quite familiar to you in terms of when we're faced with a threat to us, our bodies are responding to that, and we have different levels of arousal that then will occur based on that threat that's in front of us. So essentially, if we're faced with something that, you know, we perceive as, oh, there's a degree of threat here, you can see by the graph on that side that initially what's happening is we start to draw our attention to that and to be checking about what we can do in that situation. So for families in this example, it might be finding out a little bit about that at the beginning and wondering, well, what would the options be, asking questions, being able to talk to other people. Socially, this bit's quite important because we're reaching out to find out what the possibilities are, so peer support becomes quite important. The more that threat increases, the more that people have heard of like fight or flight response. People move to do something. I have to do something. So what can we do in this situation to be able to you know, help reduce that threat to our child? And you'll get, you know, parents asking lots of questions and urgency around decision making that come from parents, sometimes even, you know, angry responses and things like that may be familiar. And as that threat increases further, if it reaches a point where people perceive there is nothing that they can do, they become overwhelmed, and then that's where we get this freeze response. So we see people withdraw and not seem to respond, and that can be quite confusing sometimes if you're faced with somebody in a situation where you'd expect really overwhelming emotion and they're sort of withdrawing and you're not seeing much response. That can be what's going on in that context. So it's important to you know, explain that that process is a normal process, and it's our body you know, trying to protect and do whatever we can to minimize that threat. But that has impacts in terms of the information that people can process at that time. So parents processing of information, that's going to be really, really hard. And we process things differently. Our brain works differently when we're experiencing trauma. So we don't file things away in terms of memory in the same way that we would normally. So in terms of sharing information with parents at that stage, it has a real impact on what we are able to how we go about that, really, in order to do that in a way that works well, so that parents have a good understanding of what's happening and they understand what going back to that graph, what they can do and what they have to do. And the difficulties can occur with this where people get stuck really in those sort of higher levels of arousal, and we explain that often to parents as the alarm system in the brain remaining switched on. And there's a really good book, that Trauma is Really Strange, and it's like goes through cartoons and things about how we experience trauma and the impact that has. So in terms of parental coping, there's an impact there on the couple as well as the individual, which is important to sort of acknowledge, because we're trying to make sure that that system around a child's really supported at that point. The parents' reactions isn't necessarily related to the severity of that cardiac condition either, which is worth pointing out. So parents need support, even if it's something that we might see as, you know, maybe not, maybe more towards a mild end of a disease. It doesn't necessarily mean that they won't need that level of support. And we know that the quality of life of parents and families is related to other aspects that isn't necessarily the the disease itself. So financial concerns and distress, social isolation, those sorts of things. We do see that there can be a positive response the other side of this for parents, in terms of when you've been through all of this, sometimes we see that actually parents feel able to deal with other things that are coming up further down the line. And we see that in research, in terms of there is evidence of some post-traumatic growth, of parents are coping well into the future, but that isn't always the case, that we can't assume that. So but it's just to get that message out there that, you know, there is further down the line, there can be that outcome of parents really coping well with things. And obviously with each event that happens, we need there to be able to support parents to process and adjust to any further traumatic events that they experience. The reason I'm talking a lot about this in terms of parents' experiences, because the impact on the child-parent relationship. So there's so much to summarise here, and I've tried to do that really briefly, but how the relationship between the parent and the child is crucial to the development of that child, as a child, and going into adulthood as well, in terms of their physical and emotional well-being. So in the early years, it's laying down that brain development through positive interactions. So there's a really great link there on YouTube for a video that explains this much more than I'm going to be able to explain this in 2 minutes, but it's all about the way that interactions with parents and children really set up the brain for future development in terms of emotional and physical health. So things like serve and return interactions. So that's, you know, when you're seeing that interaction between a child where a child will coo and a parent will respond, and that engagement in terms of eye contact, and those interactions, they're crucial. And it's just thinking about how do the young people, the babies that come into our environments, how are they experiencing those interactions, and how are parents, what position are parents in when this stuff is really important stuff needs to be happening. And also attachment. So, you know, we've heard about attachment and the importance of attachment, but in this sort of context, we can't underline that enough in terms of the impact of that for a young person's well-being going forward, and their formation of relationships into adulthood as well. And that begins before birth. So if we're thinking back to when somebody finds out about a diagnosis of CHD as a parent, there can be an impact about, you know, when somebody finds out before a child is born, in terms of a protective element there going on, of distancing themselves perhaps from a pregnancy where they're unsure about what the outcome will be. All of that can have an impact, as well as, you know, a child being in hospital, the impact of there in terms of like bonding, the physical touch, all of those things that can happen. So that's why it's really important for us in hospitals to be thinking about those things. And also the importance of the parent-child relationship there, in terms of learning how to live with a health condition. So health beliefs and health behaviours are formed from what we see and how we interact with our caregivers around our care. And it's important for us, therefore, to think about how the position that parent is in when they're then coming to that interaction with a child around their health, and what messages they're given, what's modelled. And we need to set up parents really to be in the best position to be able to do that with their child, to be able to ensure like long-term well-being. So with CHD, these are the areas really where that parent-child, it's worth thinking about that parent-child relationship in terms of bonding in pregnancy can be affected. It isn't always, it's just something that's worth thinking about. Trauma experiences for both the baby as well and the parent. There's a whole other discussion around trauma for young, you know, for babies and young children that we need to be thinking about. But that's maybe a discussion for another day in terms of how that impacts further into life. Parent mental health issues and coping is really important in terms of how they're going to interact with their child. And parents' attitudes towards the condition itself, because it's the perceived severity of the condition rather than what we objectively might see as the severity of a condition that's important here. If somebody underestimates that with a child, it may lead to things like maybe not modelling some of those behaviours around health that we'd want to be seen, or not communicating something to children that they would need to be, that they would need to know. Overestimation might lead to, withdrawing children from activities and things that'd be really beneficial for their development because of fear around what would happen if a child was to, say, engage in more physical activity, for example. And obviously separation from parents impacts on that. If there is stages of it where children and babies are away from parents, that's going to impact to some degree. And feeding difficulties, again, which we see in this population, obviously, but positively, because that's really important to get in there, that we do have opportunity to intervene with this. There is plasticity in young brains in terms of overcoming that early adversity, and there are lots of opportunities for us as professionals to identify those issues and support. So finally, I just want to think about how professionals can help with this, whether you're working in paediatrics or whether you're coming to this from an adult CHD point of view. It's about considering those early experiences and their relevance throughout that journey. It can be useful for all of us, I think, to think about how the individual that we're working with has started life with that condition, and how that could have impacted on how they're coping now. So some of the stuff to do with attachment and things like that I'd spoken about in terms of how that impacts on a relationship and relationships with others, and how caregiving might have influenced how they then come and seek care further on in life. There's so many different ways that those experiences can impact on how somebody presents, even as an adult. And it's probably more obvious in terms of when we're working with young people, because we're quite close to those experiences, but it has an impact throughout somebody's life. And the other thing to think about is how you could help support their current and future well-being within your role, because we all have different roles in teams. So it's just thinking about those things that I've described and thinking about, okay, with the people I see, what could I be doing to support around those further down the line, or maybe earlier on. And for all of us, thinking about understanding other factors that will impact on quality of life more than the disease severity. So we've got great support throughout our teams with for things like social support, isolation, and thinking about family dynamics, considering things like financial situations that families and individuals are coming with, and again, parental coping, and also mental health of parents, but also of individuals later on in life. I've got a few suggestions, which I'm not going to go through all of them in loads of detail, but a few suggestions for those working with people and families at the beginning as well, in terms of around diagnosis, about how we can work with families at that stage to maybe improve outcomes further down the line. So firstly, thinking about the meaning of CHD and exploring that with families. So making sure we give enough time to share clear information in verbally, in discussion, but also written information about the medical condition and the possible impact on life. So both of those things, explaining the medical condition, but also having time to reflect on what that means in terms of impact on life. And I say in different formats because, going back to the trauma stuff earlier, about how people take on information when they're going through high levels of stress. Signposting to peer support, I can't say how important this bit is, because it's all about that bit of orientating to what's going on, what can we do, how will life actually be. Peer support is crucial for families, so the more ways we can link people up with peer support, the better, really. And giving information as well from peers peers giving information can be more impactful than having that from a health team. And then regularly revisiting that discussion, checking understanding. And I will just briefly go through this. So this is about bonding and interaction. So the importance of getting that into conversations early on. So making that something that we'd all talk about with parents. So how is that for them in terms of having interactions with their babies? How is their experience of bonding? Are there any barriers to that? Observing some of that in hospitals as well. Teams on the wards are great at being able to make observations of that in terms of interactions, and observing when parents maybe are a bit more withdrawn, and thinking with them about what might be barriers there for them. And also talking with parents in children about how CHD impacts on their parenting. That's something that we can all do to some degree. In terms of supporting their well-being going forward, most parents don't require referral to psychology for trauma in terms of going through some of those distressing experiences, because as I said at the beginning, that's a normal reaction to that stressful situation. However, talking to somebody does help. We know that in terms of trauma. So thinking about parents, about how they can support each other, how they're coping, thinking about how as clinicians, we speak with parents about some of these events, linking them up with peer support, talking with friends and family, in hospital, things like the chaplaincy service, but also linking with peer support. As I said earlier, that's really important. I put a few links there, but there are many, many more, and it's just, I suppose, asking around and thinking about how we can link parents up with other parents. And there are instances where referral on would be appropriate, and I just wanted to pull that out because, again, coping of a parent at this stage is really important to how they're then able to be empowered to support that child, and how that child is going to be able to function into their adult life. So picking up difficulties where reactions seem out of proportion to stressful events, trauma reactions, we know if they're continuing much longer than we would expect, that might be something to flag up. If there are other mental health issues that could be impacting, again, and thinking about risk, so using crisis teams as well where that's appropriate. For any inpatient children here at the Freeman, obviously you can come and have a conversation with us in psychology around what might be appropriate support for parents if you're not sure where to go with some of that, because we know that that can be helpful for all of us, is to have conversations about what would the options here be. So I've done a whistle stop tour through some of that, and I hopefully some of that's useful to everybody, and it's something to reflect on. But yeah, if you've got questions and comments and things, please just let me know. I'll hand back over to Kay.
Thank you so very much for that crammed full insight.
Sorry, yeah, full
psychology. No, it was absolutely wonderful to listen to and gave me lots of things to think about. So thank you very much for that. And the presentation, Emily shared that with us, so that'll go straight onto the website now, because I know she's got a number of really useful links in there for us and videos to watch. So I'll pop that onto the website at some point over the weekend for everybody to see. Has anybody got any questions for Emily at this point? I had a question, Emily, if you don't mind. I'll try and not make it too specific, but I was talking to a parent and he described coping less well now, and he is 5 years down the line of the initial traumatic inpatient stay at the Freeman Hospital with a newborn baby. He's 5 years down the line now and finding it more difficult to process that experience. What kind of things are open to him? Is that everything you've described in the last few slides there, looking for that peer support and talking therapies things?
Absolutely, Kay, because I think one of the tricky things with trauma is it can impact at any point, and there isn't a defined timescale for these things where we think, oh well, somebody's got to this point and everything's cracking and that's fine. This can impact depending on what's going on at different stages of, in that individual parent's life, what's happening with that child at that point, that, there can be triggers for things further down the line that might impact. So very much it's something it's not just immediately after somebody's experienced something traumatic, it's further down the line that those things can then later impact. So it's support for parents at any point in that journey is really important to consider. And yes, absolutely, all of those things that I'd put up there would be relevant at any point. So having the most important thing, though, I suppose, is just having a conversation. If you're noticing some of those things, starting by just being able to say to a parent, I'm noticing this, are you okay to talk about that, so we can have a think about what might be helpful to you. And then even if you don't think of all those things on that list immediately, just saying to a parent, I'm just going to go away and have a talk with other people just to find out what might be helpful to you, and then coming and talking to us in psychology, having a think with colleagues around you, looking for all of those peer support options as well, if that's relevant at that time, would be really important. So yeah, I think just the conversation is hugely important.
Yeah, and normalizing that and making that okay, that you can say I'm not doing okay. That's wonderful. Thank you so very much for joining us today, and thank you everybody for the participation during this week, Congenital Heart Disease Awareness. I do hope we've gone some way to raising the profile and raising awareness about living with congenital heart disease and the impact that has on our young people and our adults, and indeed the families. So I will say thank you to everybody who joined us, and I will end the recording there. Thank you so much.
Thank you. Thanks, Kay.
Just the button won't